Health Insurance Demystified, how premiums, deductibles, copays, coinsurance, and MOOP really impact your wallet. Hello and welcome. Today we are breaking down one of the most confusing but critically important topics in healthcare and personal finance, health plan design, and specifically how premiums, deductibles, copays, coinsurance, and maximum out-of-pocket limits actually work in the real world and how they impact your financial decisions and healthcare access. Health insurance is essentially a financial protection mechanism, but unlike other types of insurance, it involves frequent usage, complex cost sharing, and multiple layers of responsibility between the insurer and the patient, which makes understanding these components essential for making informed decisions. Let's start with premiums, which are the most visible cost of any health plan. A premium is the amount you pay regularly, usually monthly, to maintain your insurance coverage, regardless of whether you use any healthcare services or not. Premiums are influenced by several factors, including the level of coverage, the size of the provider network, geographic location, age, tobacco use, and whether the plan is individual, employer-sponsored, or part of a public exchange. And generally, plans with lower out-of-pocket costs tend to have higher premiums. While premiums provide access to coverage, they do not cover everything, and this is where deductibles come into play. A deductible is the amount you must pay out of pocket for covered healthcare services before your insurance begins to share costs. For example, if your plan has a $1,000 deductible, you will pay the full cost of eligible services until you reach that threshold, after which your insurer starts contributing according to the plan's cost-sharing structure. It is important to note that not all services are subject to the deductible. Many plans cover preventive services like vaccinations and annual checkups without requiring you to meet the deductible, due to regulations such as those under the Affordable Care Act in the United States. Once the deductible is met, cost sharing typically shifts to copayments or coinsurance. A copay is a fixed amount you pay for a specific service, such as $20 for a primary care visit or $50 for a specialist consultation. Copays provide predictability and simplicity, making it easier for patients to understand their immediate financial responsibility, and they are often used for routine services like doctor visits, prescriptions, and urgent care. In contrast, coinsurance is a percentage-based cost-sharing model where you pay a portion of the cost of a service, for example, 20% of a hospital bill, while the insurer pays the remaining 80% after the deductible has been met. Coinsurance introduces variability because your share depends on the total cost of the service, which can be significant for high-cost procedures like surgeries, imaging, or hospital stays, making it essential to understand negotiated rates within your provider network. These cost-sharing mechanisms continue until you reach what is known as the maximum out-of-pocket limit, often abbreviated as MOP, which is the cap on the total amount you are required to pay for covered services in a plan year. Once you hit the MOOP, your insurance covers 100% of covered in-network services for the remainder of the year, providing a critical financial safety net against catastrophic healthcare expenses. MOOP includes your deductible, copays, and coinsurance. But it typically does not include premiums, out-of-network charges, or non-covered services, which means understanding network boundaries is crucial to avoid unexpected costs. The design of these components reflects a trade-off between upfront costs and risk exposure. Plans with low premiums often have high deductibles and higher out-of-pocket costs, while plans with higher premiums tend to offer lower deductibles and more predictable expenses. High-deductible health plans, often paired with health savings accounts, are increasingly popular because they offer lower premiums and tax advantages. But they require individuals to manage higher upfront costs and be more engaged in healthcare spending decisions. On the other hand, more comprehensive plans, such as preferred provider organization plans or low-deductible plans, provide greater financial predictability and lower point-of-care costs, but come with higher monthly premiums. Choosing the right plan depends on multiple factors, including your expected healthcare usage, financial situation, risk tolerance, and whether you prefer predictable costs or lower monthly payments. And this decision becomes even more important for families or individuals with chronic conditions. From a policy and system perspective, these cost-sharing structures are designed to balance access, affordability, and utilization, encouraging responsible use of healthcare services while preventing overuse, but they can also create barriers to care if costs are too high. As healthcare systems evolve, there is increasing discussion around value-based insurance design, which aims to align patient costs with the value of services, reducing barriers for high-value care while discouraging low-value or unnecessary treatments. Ultimately, understanding how premiums, deductibles, copays, coinsurance, and MOOP interact gives you the ability to forecast your potential healthcare spending, compare plans more effectively, and make decisions that align with both your health needs and financial goals. A practical approach is to estimate your annual healthcare usage, calculate total costs under different plan scenarios, including worst case situations, and consider both routine and unexpected events to determine which plan provides the best overall value. It is also important to review plan documents carefully, including the summary of benefits and coverage, provider network details, and formulary list for medications, as these can significantly affect your total costs beyond the basic components. In conclusion, while health insurance terminology can seem complex, breaking it down into these core elements reveals a logical structure designed to distribute costs and risks, and with the right understanding, you can navigate it more confidently and strategically. Thank you for watching, and if you found this helpful, consider exploring more insights on healthcare systems, insurance design, and financial planning to make smarter decisions in an increasingly complex healthcare landscape.